Good afternoon, everyone. So this is Robert Hess III with Hess 3 Consulting, and today we are continuing our series under the Strategic Prevention Framework on telling your story through data and narratives. So for those of you that have been able to participate in our previous sessions, this is going to build upon some of the content that we've discussed in prior sessions. If you've not participated in prior sessions, there's good news. All of the sessions have been recorded and are available on our YouTube channel, so they're publicly available and you can share them with friends, watch them as many times as you want. We highly encourage that. So if you've never met me before or never participated in one of our webinars, I have about 15 years of experience working in health and human services. A significant portion of that period of time has been working in prevention in various shapes and forms. So I've done quite a bit of work under the Strategic Prevention Framework, working with community-based coalitions, working with states, and even at the federal level, working with SAMHSA, doing some work around cultural competency and technical assistance. And so our topics and conversations today, I will try to incorporate as much of my experience as possible working with several different organizations. I've been working in Arkansas and providing these trainings, and as well as being there in person now for about 6 years. So it's an honor to be back and to be included and to see you all. Lots of familiar names and faces, I guess names at this point. But faces when I get to come to town. So our work also focuses around a lot of the core tenets of the strategic prevention framework. You can see strategic planning. Project management obviously is a component of the implementation phase and capacity building. It has some alignment with the development pieces, assessment, evaluation, and of course, monitoring is in quality and process optimization. And then things like today, information management, helping folks kind of document the way that we're interacting and communicating, and of course, is always an important component. So for today's session, as I mentioned, this is really building upon some of the trainings that we've done previously. So we kind of are following the SPF dial. So we started with some conversations around assessment. We moved to some conversations around strategic planning. We did some trainings then around implementation. I think our last training was around capacity building and some of those components and contracting. And so today we're going to be focusing on really sharing your story and using data. And so we're going to talk about outcomes, which we've talked about previously. And we're really going to get to some of the nuances on some of the best ways that we can use our data and information, just to track it and really integrate it into our strategy and planning, as well as our implementation and the work that we're doing, as well as using our data to engage stakeholders, to procure additional resources. I think today's topic and the frame in which we're going to present today's topic really translates into a lot of different areas. So we're going to talk about defining outcomes and collecting data, which is not going to be what's the word I'm looking for? You should find a lot of alignment with our previous conversations around how we've been structuring our prevention activities to date. And so we're just going to fold in and add in some of the data components and outcome reporting. We're going to look at methodologies for reporting those outcomes and how we want to present that information. And then there's only there's 2 slides on this, but actually I think it's going to be the most interesting part at the very end. We're going to talk about sharing our story. And so, of course, we use this in a lot of ways. And so, again, we can use it for stakeholder engagement. We can use it in grant writing and applications. We can use it as an elevator speech. There's a lot of different ways that storytelling, quote unquote, is going to help us and benefit. And that can be from recruiting volunteers. Again, so we'll talk about some strategies on how to go about that as we dive in. So let's get started. So as many of us are probably aware, outcomes as defined by the U.S. Department of Health and Human Services is the degree to which policies, programs, services, and research for a population increase health outcomes and the conditions in which the population can be healthy. Excuse me. I'm going to change that right now. And so outcomes are looking at a number of different things, and I think it's coming up, another slide that kind of incorporates how outcomes fit into some of our previous work or previous discussions. So in the past, we've talked when talking about strategic planning, we've talked about kind of our goals, our strategies, our activities, our inputs, the process, and then our outputs. And then the outcomes are really, as a lot of folks are aware, what do we want to happen? What's the actual change that we want to happen? What is the point or the reason why we're doing the work that we're doing? And a lot of that is to achieve these particular outcomes. And so the degree to which our policies, our programs, services are able to achieve those things is what we're really trying to measure. And so if our goal is to eliminate or eradicate adolescent substance use in the state of Arkansas, our outcomes are going to help us define how we actually did that or if we were able to do that. So another definition is the extent of significant improvements in population health equity, quality, and safety that can result from changes in this area. So again, it's a measurement of all of the work that we're doing, so the changes that we're doing in relationship to adolescent substance use, it's the extent to which we've been able to do that. So in previous work, and I know I've talked about this before, but looking at driving suicides to zero is a national campaign that's been implemented, and there have been specific health systems like the Henry Ford Health System and a couple of other health systems across the country in particular states or regions or for targeted populations that have been very successful at actually eliminating suicide within their population for a sustained period of time. I think Henry Ford was able to go 5 years without a single suicide amongst their patient population, and they, previous to their interventions, had experienced a dramatically high suicide rate among their patients. And so it was a tremendous experience and example of kind of how improvements and interventions can actually drive to outcomes. And of course, their goal was to eliminate suicide, and the outcome was they eliminated suicide, at least for that 5-year period of time. And I think if I'm a little out of touch with the current data, but I think they only had one suicide that kind of ended that track, and then they've since been able to sustain 0 suicides since then, and it's been a couple of years. And so, but we're really talking about how do we know that we're doing a good job, and how do we tell other people, and how do we convey to other people that we're doing a good job, and that's what we're really talking about with our outcomes. And so here is my very simple example, and it's a little bit later in the afternoon for you guys. Oh no, it's a little bit earlier. It's 1 o'clock. So hopefully you guys have all eaten lunch because I love peanut butter and jelly sandwiches. And so we're going to use this as an example. So our goal is to satisfy 100% of hunger right now. The problem is that I'm hungry. So the goal is to satisfy 100% of my hunger right now. The activity or the strategy would be to prepare food, and the activity would be to make a peanut butter and jelly sandwich, right? So our inputs, obviously we need peanut butter. You can go crunchy, you can go creamy, you can go natural, you can go whatever way, almond butter, whatever you want to do. You want some jelly, you're going to need some bread, you're going to need a knife, you're going to need some energy, and you're going to need a plate if you're fancy, so that's optional. The person who's responsible for this is me, and the output, so when we put all of these inputs together, the output is going to be this compiled sandwich, peanut butter and jelly sandwich, as well as the waste or the discarded components of a dirty knife and a dirty plate if you decided to use a plate. And so all of these are the components that we've talked about previously on our strategic plans. And in our other activities prior to this, our project management discussion that we had a couple weeks ago and all of that. So these should all be pretty familiar terms. And again, if they're not, please check out our previous trainings that are on YouTube. So the outcome, though, is what? And I'm going to ask if you guys wouldn't mind typing in the chat box for me, what is the outcome of this process here? So again, the problem was that I was hungry. We've designed this wonderful intervention of a peanut butter and jelly sandwich. And what is the outcome of all of this work? Exactly. So I'm not hungry anymore. Yay. And I know this is a silly example, and so please I'm not attempting to patronize folks, but exactly. So the outcome is we were able to absolve my hunger, or we were able to mediate my hunger, satisfy my hunger. Exactly. So you guys have all got that. And you can see that that is directly aligned to my goal. And again, in previous conversations, we've talked a lot about making sure that our goals are really clear. And the reason we do that is because when we're starting to measure our outcomes, is we need to be able to easily and clearly be able to see the connection between what we intended to do in the beginning of our project and what actually happened at the end. So it's almost we're creating a hypothesis and then we're validating it with this data. So our hypothesis is that we can prevent suicide, or that we can reduce adolescent substance use, or reduce the number of drug overdoses. And then we design this wonderful intervention, which are our strategies, activities, the inputs, and all of that stuff. And then at the end of that, we're going to see an outcome that aligns directly with our intended desire to eradicate suicide, or see a 10% reduction in adolescent alcohol abuse, or whatever that is. So aligning these things is really critical. And again, just trying to give a silly example, but it's something you're going to want to clearly and cogently make that linkage in the very beginning when you're devising your strategic plan, and then when you're identifying what your outcomes could, would, and should be. So how do we do this? And how do we go about it? So first, and as I was just describing, you go back to your strategic plan. And again, this is why it's so important that that plan is very thoughtfully kind of considered and developed. And if your current strategic plan doesn't really isn't up to snuff, so to speak, or wasn't initially formulated in a manner to make this kind of an easy process, then absolutely feel free to go back and revisit it. A lot of this, and I take this with a grain of salt, of course, but some of this does come down to wordsmithing. Maybe we worded a goal in a way that wasn't really measurable, so we need to go back and kind of tighten it up a little bit so that we can actually align some outcome measurements to it. That's totally fine, especially if you hadn't thought about this or it wasn't a requirement previously. It's okay to go back and tweak the language and still have the intent of the goal or activities, but just make them a little bit more refined so that you're able to align this information better. So review the goals listed on your strategic plan. Of course, you're going to answer the question, or ask the question first and then find the answer. How will we know that we did this? So you're going to look at your outputs. Again, I'm going to know that somebody made a peanut butter and jelly sandwich because there's a dirty knife with peanut butter in the kitchen sink, right? So it's going to be very clear that this happened. We'll know that training was completed by evaluations that are submitted, and that's how Lorraine is monitoring the impact or the output of this training today, which is why you need to complete your training evaluations. And so those outputs become methods for us to collect outcome data. So let's use that training evaluation as an example, because it's also very common that a lot of our coalitions and groups do a lot of training. And so the output is we collected 25 training evaluations. The outcome is what those training evaluations say. And so on our training evaluation, there are questions about satisfaction. There are questions about general comments where people oftentimes leave information about what they learned, what was new to them, things that they want to know more about. So we're able to measure a lot of different components, which are our outcomes. And fortunately, it seems like we've had a lot of success in our training series based off of those evaluations, which is why Lorraine keeps bringing me back. So please keep giving us feedback. But so I wanted to pause and take a question, or take a moment to ask these questions that are on the right-hand side. So what are the outputs that you're currently collecting within your coalitions? So this is based, or your prevention activities. I recognize not everyone's a part of a coalition. You could be with an organization or a volunteer group or just concerned parents. So what are some of the things that you guys are currently collecting today in your activities? Go ahead and type in the chat box for me. Again, it could be training evaluations. It could be number of flyers distributed. These are looking at outputs. Yeah, perfect, Tara. Thank you. So we are seeing some evaluation forms, pre and post tests. What other things? Lots of pre and post tests. Cool. So I'm assuming Laura and Tara, if I'm pronouncing your name correctly, forgive me if I'm not, that we're doing some form of training. The intervention is, yeah, perfect. Satisfaction surveys, absolutely. And if you work in a medical setting, patient satisfaction surveys are all over the place, and they're a very core component that a lot of organizations, healthcare organizations, use to get information from their patients. So yeah, perfect. And so those are the tools that we can use to start collecting our outcomes. And then the questions that are on those tools are going to be specific to your program and your goals. And so even if, as I mentioned previously, if you've designed goals on your strategic plan that aren't specifically measurable, then that might be an opportunity to kind of tighten up that language. But also, if you've designed tools, if your pre and post tests right now, or your satisfaction surveys, or your coalition functioning instruments, or community readiness assessments, or whatever it is that you're doing today, if they are not aligned to your strategies, so first thing is if your strategies are not necessarily measurable. But second thing is if your tools, your data collection tools and instruments are not aligned back to your goals and very explicitly, you want that to be very clear, then that's an opportunity to go back and revisit your existing tools, your whatever you're using. So those pre and post tests, satisfaction surveys, etc. Because when we get a little bit further down in this training and we start talking about how you're going to present this information and make a very clear and cogent argument or position statement on your impact and effectiveness, you don't want to be talking about preventing adolescent substance use or let's say marijuana use in how do we want to describe this? So let's see, if your target focus is on adolescent marijuana use, and specifically, after school or something like that, when they're unsupervised, you don't want your tools to be asking questions about alcohol use or about how parents are intervening or disciplining their children when they're caught, or those types of things, because that doesn't directly align back to the intended program or intervention or the goals of your program, which are to reduce marijuana use when youth are unsupervised. And so you just want to tighten that up. So I think that you guys are pretty clear on some of these things, but let's just go through this really quickly. Quick example or quick activity. So as you described, outputs are not outcomes. And so if you would, let's say an output, we're going to use the number 1, and the outcome, we're going to use the number 2. And I'm going to have you guys answer these for me in the chat box. So distributing 1,000 flyers, is that an output or an outcome? An output, type the number 1, an outcome, type the number 2. All right, yeah. You're absolutely correct. So this is an output. What about the next one? Developing a referral and resource list. This one's a little bit more vague, or depending on, it could be interpreted a couple ways. So I recognize that. So developing a referral and resource list. So a lot of number 2s, right? So, and this is why I say this one's a little bit of a trick. So it depends on how you're framing it. So if the list itself is what we're discussing, then it would be an output because it's a tangible thing that we did some activities, and the output is that we now have this list. If it's about connecting people to resources, the outcome would then become how many people have been impacted or helped by this resource list. So I should probably reword this, but it also comes down to some of those nuances. So again, you want to think tangibly, or I'm sorry, you want to think really concretely about what it is that we are talking about. So this one, The correct answer is it depends. There's a little bit of a trick, but hopefully the other two won't be as much of a trick. So the next one, training 100 people. Is this an output or an outcome? So type 1 if it's an output, type 2 if it's an outcome. Absolutely. So this is an output, correct. Yep. And then passing a city ordinance increasing secret shopping at liquor stores. Is this an output or an outcome? Yeah, so I think again, this is another one that could be open to interpretation. So the actual document itself, that is the city ordinance, which yeah would be the output, like it was passed, it happened. The outcome would be the what happened as a consequence of this. What is afterwards? So that would be the number of organizations or liquor stores that have been kind of had corrective action, or it'd be tightened. How would we describe this? So the correct outcome of passing a city ordinance would be about a reduction, an overall reduction in liquor sold to minors. And so you can measure that a number of different ways. So again, it is not as black and white, and this happens a lot when creating outputs and outcomes. Sometimes it's contextual, sometimes it's open to interpretation. And so these are put here as a means to kind of cause us to talk it through, as well as think through very concretely on the way that things are worded and specifically how they're being measured. Because you can't, in order to justify an outcome, you have to define kind of the methodology in which we're going to measure this. So if we're measuring the passing of a city ordinance based on it actually being passed, the output is kind of the document, and the outcome is speaking more to kind of the impact of what that may be. So how that reduces the overall number of alcohol sold to minors or people that are do not properly show ID, those types of things. So I know that may be frustrating. Welcome to the world of outcomes. I oftentimes find myself debating these things with people all day long. So there is shades of gray, and there's room for interpretation. And it just makes sure, I guess the point here and the lesson here is in that discussion, think real critically about it, figure out the language to be as specific and concrete and finite as possible, so that when asked, you can kind of justify those two things. So let's keep rolling. So the strategies that we use for collecting outcomes, there's a lot of different things. And so some people, depending on this really goes back to, again, kind of the scope of the work that you're doing and the goals that you've designed. So there are existing data sources that are out there routinely collecting information. And I think a lot of times we overlook that, and we feel like we have to collect information ourselves. And that's not always the case. And so there's definitely an opportunity to align your efforts and your prevention activities with kind of these larger, more broad existing data sources. And so if we were talking about true population health, like true population level environmental strategies for prevention, we would want to be looking at, depending on the geographic scope of your work. So let's just take the state of Arkansas as a whole, because this is what the state health department is looking at. They should be looking at the entire state of Arkansas, and they should be looking at substance abuse epidemiology. So how many people are using substances, what specific substances, their ages, and if we're going to talk about underage substance use or adolescent substance use, then we would obviously look at 20% of adolescents in Arkansas have reported substance use in the last year. So let's just use that as our number. So that means 20% of all adolescents in the entire state of Arkansas have reported substance use in the last year. So we would look to kind of national, state, and then potentially city or county level reports that kind of track that information. And this information does get routinely tracked. It's tracked in emergency departments, it's tracked by health plans, it's tracked by the state. There's a lot of different methods that use that. And so we could, in theory, if the data is broken down, or we could request the information from one of these sources, we could use their data as the means by which we are monitoring our outcomes or the effectiveness of our program. And again, it comes down to the goals. So if our goals are specific to a school, it's not likely that a national survey or national data collection tool is going to be collecting information at the school level. So they're obviously not going to be appropriate. We could use hospital utilization. So depending on where you live geographically, if there's only one hospital and you're looking at monitoring overdose patterns or something, you want to reduce the number of overdoses or number of emergency department visits for an overdose, then you could use the hospital's data. And again, it would require a relationship with that hospital, or maybe you are that treatment provider and maybe you're the only treatment provider in a particular geographic region. These sources, they are applicable based off of the context in which you're working. And then, of course, using routine data. And so if you are a provider yourself and you're looking at some specific or you're continually monitoring information, you can extract this data from your electronic medical record. What a lot of our nonprofits and community-based coalitions and organizations end up doing, though, are what you guys described previously, looking at training pre and post tests, looking at community readiness assessments, looking at core prevention surveys, designing our own, using our needs assessment. So if we do that on an annual basis or every 3 years or however frequently, we'll say, when we did this assessment at year 1, adolescent substance use prevalence was 20%. We did this assessment in year 2 or year 3, adolescent substance use prevalence was 15%. So we've seen a 5% reduction overall prevalence, but that's a 25% reduction in adolescent substance use. And we'll talk about those numbers shortly. So we can use that information. And so you guys described pre and post test previously on the previous question. Are other groups or anyone else participating today, are you using other methods to collect information, or how are you currently collecting your outcomes data? Go ahead and type in the chat box for me, whatever your existing methods may be. If you're using pre and post test, please feel free to kind of retype that for me. But what are the tools that we're currently using to collect outcomes data? So when, Derek and Tiffany, so when you say evaluations, are those surveys? Are they, what do you mean by evaluations? Are you using routine data? Okay, perfect. So the use of surveys, participant surveys, perfect, yeah. And so those methods, and we're not going to get too deep into like a methods conversation, but yeah, those sources of information are absolutely helping. Yeah, and so Rita, it sounds like you are potentially in either an inpatient setting or a treatment setting, so you're working with folks to set individualized goals at intake, and then of course you're monitoring progress on those treatment plans potentially, or at least at the end of the program. Awesome. So yeah, so these tools are really helpful. The nice thing about kind of these surveys and tools is that a lot of times we have a lot of ability to control them and update and edit them. So if we needed to add a question, we need to delete a question, a lot of that is really helpful. Whereas with a state level source or a national level source or even a city or county level source, they're administered by a third party, so we don't necessarily always have the ability to ask exactly what we want to ask and to really make it as specific as we need to for our particular population. So there's definitely some advantages. And this particular training is not specific around designing surveys or even methods for data collection, but if for whatever reason there's an interest in that, we can absolutely have kind of a methodology and a methods conversation around data collection. So what we really want to do, and we're starting to transition a little bit into some of our outcomes reporting, right? So we previously, or up to this point in today's webinar, we've talked about what are outcomes, how do we monitor them, aligning them back to our strategic plan, and so we're kind of pivoting or kind of curving ourselves to more about, so what do we do with this information and this data, right? So we are collecting these tools. The questions have been perfectly and flawlessly aligned to our strategies and our goals, so we know we're collecting the right information. So what do we do? So simple measurement of change equation is we look at where we are minus where we were, divided by where we were. And so this is the rate of change equation that's used in statistics. And we use this to help document our outcomes. So some people, and even in the previous example I talked about, where I mentioned, if we started this intervention and there's a 20% prevalence of adolescent substance use, so 20% of all the youth in Arkansas are using substances, and 3 years later, we got that number down to 15%, it might not sound as dramatic to say, oh, well, we saw a 5% reduction in substance use because 20% minus 15% equals 5%. But that's not actually the rate of change that we saw. What we saw was a 25% reduction in substance use among those that were using substances, which is a much more significant outcome and impact. And so as we're monitoring our outcomes, that's the way we want to present our information. And so I hope that this is something you guys are all familiar with. I definitely am not an expert statistician, and so I'm not going to, go too deep into some of the mathematical and statistical components here. But we want to be careful, or at least be specific, when presenting our information, that we're presenting the actual impact of our work. So we're presenting that 25% reduction, not the 5% change, because obviously those are two very different numbers. And if we're presenting 5%, we're really undercutting the actual impact of the work that we're doing. So here's just an example, a very similar example, not the exact one. If in our so we're looking at pre and post tests. So if before the training, before we offered this wonderful, flawless, amazing, very effective, very cost-effective training intervention to youth, 20% of youth could identify risks related to underage drinking. So we walked in, there's 100 kids there, 20 of them could say, yeah, drinking and driving is bad, or you can have alcohol poisoning, or all those things. So they could identify risks related to underage drinking. After the intervention, there were 50% of youth can now identify risks related to underage drinking, because the other 50% were updating their Snapchat and on their cell phones the whole time, not paying attention. So step one, where we are minus where we were, which gets us to 30%. So 50% minus 20% equals 30%, divided by where we were, 20%. So what we're seeing is that there's actually a 150% increase in knowledge regarding risks of underage drinking. So it's not, it is 30% of 30% more students are now able to identify risks related to underage drinking. That's one way to present that information. But the other way that kind of otherwise demonstrates the impact of our work is this 150% increase in knowledge, because we're seeing that now more than double, 1.5 times as many people are now able to identify risks related to underage drinking. Excuse me, sorry, I don't know why I'm stumbling over my words so much today. And so using this rate of change is a really effective way, again, to really kind of communicate the work that we're doing. So sharing our data using graphs and charts and information, there are so many ways, and I'm thinking we're actually hitting the end of this presentation much faster than I anticipated. So I should have added in some more slides here, forgive me, around ways to display information and data, because there are a lot of different techniques that can be used. A lot of this can be done in Excel and does not need to be done in fancy statistical software such as SPSS or Stata or some of the other packages. If it's not something that you're very good at, it's definitely going back to some of our outreach and engagement techniques and things we've talked about. It's a means for us to recruit and or develop those skills, which are the two ways that we kind of increase the capacity of our coalitions and groups. So finding someone that's able to analyze data in a statistical way is really important in helping us to share our story and helping us to be able to construct those meaningful and impactful statistics that we talked about in the last couple of slides. And so once we go through and we collect our surveys, whether that be, again, through pre and post tests, or we're using kind of that larger systemic data collection from the state or from the federal level, city or county level, we want to be able to identify where those key statistics are. So where do we see that we've really made that impact? And again, this is all aligned back to our strategic plan and our goals. And so we said that we were going to reduce overall total adolescent substance use in the state of Arkansas. We saw a 25% reduction, so going from 20% of youth reporting substance use in the last year to 15% of youth reporting substance use in the last year. So that's our 25% reduction. So we've been effective in a year's time at reducing substance use among adolescents by 25%, which is really significant. So that becomes a statistic that we're able to utilize. And we want to present that information in really innovative ways. And so, of course, there are bar graphs and line graphs and charts and things based off of, the frequency in which you collect your data and the timeline in which you're working and operating. You want to decide kind of the best ways for you to be able to do that. There are also fun websites out there called such as PictoChart and a couple of others that can help you construct infographics, which I'm sure a lot of us have seen before and have always. I remember the first time I saw an infographic and I was like, how did they do that? Because they're really compelling in the way in which they communicate and convey information. So I'm going to drop this link for you. So PictoChart is one of the easier ways or templates to be able to create infographics and be able to in a compelling way, be able to share your story with other individuals and graphically be able to share that. And I'm assuming, go ahead and give me a response. How many of us are familiar with infographics? If you could just type yes for me or a Y in the chat box. When I say infographics, you know what I'm talking about. If you don't, obviously, please say no. Okay, perfect. Well, let me see. We're going to be really, this is live action, y'all. We're going to see if I can find us a real quick example. Hold on. Oh, well, that's exciting. All right, so, oops, wrong thing. Forgive me. All right, here we go. So I just switched over the screen. So what you should be able to see is an infographic. It's a very weird infographic of strange ways to get high. And so you can see they provide a number of compelling images and information on how different things operate. So these have been used in quite a few ways to share your story visually and information that you're wanting to convey to folks. And so here's one on the impact of substance use on the brain. Again, they all look very different, but it's just an interesting graphical way to kind of help convey typically complex information. And you'll see there's a lot of, SAMHSA started using these quite a bit. They've become kind of all the rave. So here's just, again, a lot of different examples. Here's probably a more applicable one to the work that we do. So an infographic on alcohol use among college students. And so you can see, the way that we present some of those statistics that stem from our needs assessment, and kind of the negative impacts and outcomes for what some of those things may be. So I'll just finish scrolling here, and then we'll go back. Oops. Sorry. All right, so yeah, Michael, so the infographic that, I'm not exactly sure which softwares were used for the ones I just pulled up, but that link that I dropped into the chat box, the PictoChart, let's see if I can drop it one more time for you. There you go. So PictoChart.com is one software that is used. There are several other options out there. PictoChart's the one that I utilize in some of my work. Because it's easiest and it's not super expensive, especially if you're a student or can use a student's login or connected to a university, I guess. And so, yeah, absolutely. That's one very compelling way to be able to share that information. A couple of other things, and this is, again, like I said, we move forward a little bit more quickly than I anticipated. So I'll just do a couple of things that were not in my script for today. Another thing that I like to utilize a lot, that's a little bit more traditional, but will probably speak to a couple of other audiences, are dashboards. And so a dashboard, in a lot of ways, is just a lot of graphs and charts on one page on a single piece of paper. The concept here is literally just like your vehicle's dashboard. It gives you all of the key information that you need to be able to understand what's happening. And so an infographic is kind of like a fancy schmancy version of a dashboard. It's just, and this is a more kind of traditional form, to where maybe, this first dashboard is like your demographic profile of your community. Your second dashboard talks about the amount of hours that children or adolescents are unsupervised. You look at your third graph on here is going to look at, risk factors that the youth in the population may be experiencing. Your fourth graph, looks at the actual substance abuse utilization. So what are the trends? Your fifth graph would look at maybe potentially the negative outputs or outcomes from that. So whether that be dropout rates or incarceration rates, or unfortunately, even if there was death by substance use, you could look at all those components. And the goal is that on a single piece of paper, you can hand that to someone and be able to convey, this is what's happening in our community. This is what's happening amongst our youth. And it really becomes kind of like, a graphical depiction in a more traditional, again, using pie charts and line charts and bar graphs and things like that. But it gives someone all the information that they need about the issue at hand in a single piece of paper. So again, similar to you driving down the road, and you can see, your miles per hour. You can see how much gas is left in your vehicle. You can see, if your blinkers are on. You can see the check engine light. Your dashboard in your vehicle tells you everything you need to know about operating your vehicle. So the dashboard, from a data perspective, for your program, would tell potentially a stakeholder or a funder or a donor everything they need to know about your project or your program on a single piece of paper. And again, an infographic is just a prettier, fancier version of a dashboard for the most part. Dashboards are used a lot in like operations and management, so that people in program operations, I'm sure some of you guys that work in treatment centers and hospitals, you may be more familiar with these, because they typically are used, month to month to track how many people came in and how many people came out, and kind of your key indicators, key performance indicators, or KPIs as they like to be abbreviated. But those are all different ways, again, to kind of graphically display your data that you've drawn from your needs assessment, first and foremost, but then also from your survey tools and the other tools that you're using, instruments that you're using to collect output and outcome data. And it's absolutely acceptable and okay to include output data in your story when you're talking about this. So you can say, we trained 1,000 people. That's a huge amount of labor and work, and it's definitely honorable and something that should be discussed and shared with your stakeholders about how much work you're doing. But then you want to make sure that you're conveying kind of those outcomes and talking about, okay, well, what actually happened when you trained those 1,000 people, and what did their increased knowledge or intended behavior change, or if you're able to do like 3-month or 6-month follow-up, did they actually change their behavior afterwards, etc. So I want to spend the last couple of minutes on kind of the narrative version of this. And I was a little cautious to go down the path of talking about an elevator speech or some of those things, because that's not really what I am envisioning or what I convey to folks. In my professional life, I have never once sat down and written an elevator speech. I know a lot of people do that, and it's a really good planning activity. But what you're really wanting to do is design kind of your talking points to share your story. And so in storytelling, which is one of my very odd hobbies, there's a number of storytelling events that I've participated in just in the community, and done some professional storytelling, which I really enjoy, for the exact opportunity that I think makes it pivotal and actionable within our work, is because you're able to really kind of influence people's emotions and influence the way that people think about you as a person and the work that you're doing. And so obviously we're focusing on kind of programmatic storytelling, but what we're going to do is kind of translate this into some of our the way that we describe the work that we do and how we engage people in the work that we do. So the storytelling arc, as we like to call it, and this is pretty traditional, especially if you did like creative writing or have taken writing classes either at college or even maybe in high school. They talk about this as well. You first always start off with the setting. So what was happening before you began your work? So before our coalition was developed or before we started this new program, because maybe your coalition's been around for 50 years and what was happening 50 years ago is irrelevant. But we have a new program that we're starting to address, increasing meth use in the community, because that is a reoccurring or an emerging issue in our neighborhood or in our community. So what was happening before you began your work? So there was little awareness about this issue. No one was talking about it. There wasn't any capacity within the system, the treatment providers, to actually address this issue. And sadly, we want to talk about why this is bad. So getting to that struggle component. And because no one was aware about this and no one had the capacity to address it, our youth were becoming highly addicted. We had 3 students pass away, unfortunately, or maybe they were arrested and put in jail when it was really a mental health issue that could have been handled in the community. You really want to spend time to think about, why is this bad? And that might seem obvious to you why this is bad, but it might not be obvious to your audience. And so you want to be very specific and think through. And the key to effective storytelling is really explicitly conveying the things that you think are important in the story, as well as you see. And I love this diagram, because the way they thought about it is the fish in the beginning, and then there's all of these little dots that you have to connect to get to the fish at the end, the resolution. And so those little dots that we have to connect to bring them through this story are going to be using, like I described earlier, being very explicit about how your goals connect to your outcomes. And you really want to be as overt and forward about, we know that this does this because of this, or we know that because we implemented this program, we've been able to see X, Y, and Z as an outcome. So when describing your story, and this is the actual, like the tangible product that this lives in, can be a number of things. This can be literally a written description of your program, of your coalition, that maybe you use it in promotional materials, maybe it's on your website. You can think through, kind of where like a short version of this and a long version of this may be most applicable. But this also becomes the talking points that when you are engaging a new volunteer for the first time, or sitting down with a donor, or applying for a grant, or talking to Lorraine about your program, or what your needs are in your community, and seeking assistance or resources or whatever. You want to have these talking points so that it can be succinct. And again, I am very opposed to using the term elevator speech, because I think that puts people in a box. But you should have a 30-second version of this, and you should have the 30-minute version of this that you're able to be really compelling with. So you start with the setting, what was happening before you began your work. You talk about why that was bad, what was wrong, all the negative things that were happening in the community. And the turning point is you. You are the turning point. That is the moment that you launched your coalition. That is the moment that you started conversations with people in the community about what was going on, and identifying what they thought their needs were. So start talking about your needs assessment. Start talking about how you guys organized. And again, if you've been around for a long time, you can talk about how like a new program has been evolved, or how you came to your most recent strategies for your strategic plan, or again, whatever it is you're seeking funding for. So you describe what did you do to fix it, if it's kind of retrospective, or what do you do currently to prevent it? So describing the existing program. So we're doing education. We are, working with the police department on implementing city ordinances to restrict underage drinking. We're doing secret shopping programs. Like, you become this turning point. And then you get to these resolutions, and the resolutions are, how do you know it's working? And that's the exact same question that we asked earlier in this presentation about how do we know what we're doing is effective? And that becomes describing your outcome. So we have seen a 25% reduction in overall substance use in Arkansas. We have eliminated suicide in our hospital system, or within our county or school. Students are reporting stronger social connectedness, enhanced relationships with their families, greater knowledge about substance use and the negative impacts of substance use or underage drinking. I mean, whatever those outcomes may be. And again, you want to use those measurable outcomes that we've talked about, but that becomes your story. And again, you can use that in written form, in a brochure. So have, again, that 30-second version, to those little have bullet point version of this where it's real succinct and short. And then you can do entire conference presentations and talk for hours about how amazing you are, and the work that you've been doing. And I really hope that you will do that, because people need to hear those stories and success stories of what you guys have been doing in your communities. I'm going to go ahead and wrap us up there, which is just a little bit earlier than typical, but I want to take some time to see if you guys have any questions. We've hit on quite a few things today. I probably could have drawn some of the topics out a little bit more, so I will keep that as feedback for myself in the next round, and making sure that I go into more explicit detail about some of these topics. But I would love to see if you guys have any questions, first and foremost. And please type them in the chat box for me. And as you guys are typing them in the chat box, I'm going to go ahead and drop this survey link for you. For those of you that have participated with us before, that in order to get credit for today's session, you do need to complete this evaluation in the next 48 hours. And so, hold on, let me just type this. Okay. So there is the link for you. And there's my cell phone number as well as my email address. I'm always available to connect you to resources. Like I said, I know I shared kind of PictoChart, and we talked about dashboards, and we talked about quite a few things. Some of them were kind of in the back of my mind, and I'm glad we were able to bring them forward. But I have a lot more resources where that came from. So if you are interested in kind of learning more about storytelling and how you can incorporate that into your project narratives, and or interested in some of the other graphic tools to graphically display your information, I'm happy to share those as well. I'm not seeing any questions being typed in the chat box, so please feel free to do so. I'm going to go ahead and stop our recording for this afternoon, but thank you guys so much for participating. I'm giving you back 5 minutes of your life, so hopefully you'll be able to use that effectively for your day. It's always a pleasure. We do have a couple more trainings coming up. Sorry, I should have mentioned this. So on the 12th, we're talking about contracts and funding streams. And then on the 26th, we're going to be talking about cultural competency. And so those should be two really exciting sessions, and those will be our last two sessions in this particular training series for the year. So once again, thank you all for participating, and I look forward to hearing from you.